Rash plus vomiting. Is that anaphylaxis or just an allergy? Can hypotension alone be enough to call anaphylaxis? Not every allergic reaction is anaphylaxis, but missing anaphylaxis can be fatal. Here's how to diagnose it in less than 1 minute. This is the most widely accepted diagnostic criteria for anaphylaxis, and this was jointly published by National Institute of Allergy and Infectious Diseases and Food Allergy and Anaphylaxis Network. According to this criteria, anaphylaxis is likely if there is rapid onset of symptom. Rapid means developing within minutes to hours, and any one of the following 3 criterion. The first criterion is skin or mucosa involvement, such as hives, lip or tongue swelling, plus either hypotension or respiratory distress. Let's take an example. A patient eats peanuts and within minutes develops widespread rash and wheezing. This meets the criterion 1. Here rash means skin involvement and wheezing means respiratory distress. Let's take another example. A patient develops lip swelling and suddenly becomes hypotensive, and this all happens after receiving an antibiotic. So this is also anaphylaxis according to criterion 1. Here lip swelling means skin or mucosa involvement, and hypotensive means this is cardiovascular or hypotension. So this meets the criterion 1 and is anaphylaxis. Now let's see criterion number 2. According to this criterion, involvement of more than or equal to 2 organ systems after exposure to a likely allergen. These are the 4 organ systems that are classically involved in anaphylaxis. The first one is skin or mucosa, respiratory system, cardiovascular system, and gastrointestinal system. This fourth one, gastrointestinal system, is often missed but is very important in the diagnostic criterion of anaphylaxis. Let's break it down with suitable examples. A child eats a cookie containing peanuts and develops hives plus remitted vomiting. This is skin plus GI involvement. Another example, a patient receives IV contrast and develops wheezing and dizziness. Here wheezing is a respiratory symptom and dizziness is cardiovascular system due to hypotension. One more example, a patient following bee sting develops generalized rash and abdominal cramps. Here rash is skin involvement and abdominal cramp is GI system involvement. Lastly, the third criterion, and this criterion says hypotension after exposure of a known allergen. This is also anaphylaxis. Let's make it clear with an example. A patient with a known penicillin allergy accidentally receives penicillin and becomes hypotensive within minutes. This is anaphylaxis. So from now onward, please remember hypotension alone can be anaphylaxis. Rash is not mandatory for the diagnosis of anaphylaxis.